Hi, my name is Rosie and I am a student nurse. Today what we'll be performing is 4 skills. I will be inserting a nasogastric tube, irrigating the tube, suctioning the tube, and removing the tube. I have all my equipment set up here. We have our gloves, tube, lubricant, syringe, tape, our stethoscope, our towel is on the patient, tissues, a cup of water, and our saline solution. So first what we want to do is go ahead and check the MAR to see if we have approval from the doctor to go ahead and do all those steps. We want to explain the procedure to the patient, and we want to go ahead and verify that you have the correct patient. So once you have all that and once you have the correct patient, I'm going to perform hand hygiene, provide privacy, and we can continue on to perform the skills. So I will first off start by applying my gloves. Okay. You want to make sure that the patient doesn't have a deviated septum or any nasal obstructions going on. You can also have the patient tell you if anything is wrong with them. And my patient seems to be fine. No nasal obstructions going on, so we are good. So what we want to do first is go ahead and we have our towel. Go ahead and place the patient in a comfortable position. We want to go ahead and measure the tube. We want to start off by measuring from the tip of the nose to the ear, down the xiphoid process. Once we have that done, we want to go ahead and get tape to mark our stop section. Okay. So we have our tape. So now we want to go ahead and get our water ready, just in case if they start to gag. So I will put my stethoscope on first, just for further on. Okay, and we will start the procedure. You want to go ahead and lube up the tube here first. Okay, so it's lubed, and we will start. So what we want to do is go ahead and start on the right nostril with insertion. You might feel some sort of resistance, but that's okay. Just go ahead and twist the tube around to make it easier to insert. Okay, and it has passed that resistance area. So now the patient might start to gag. So what you want to do is have him sip a little bit of water and swallow. And every time he swallows, go ahead and start inserting an inch of the tube. If he continues to gag, go ahead and stop and have him relax and keep on sipping on the water. If that still continues, go ahead and tilt the head back and check with the light in back of the oral cavity and back of the pharynx to see if the tube is going in correctly. So once the patient's ready, go ahead and keep inserting the tube. Okay. And the tube doesn't go in all the way, but this is our stop mark, where all of this should be inserted in the stomach already. This is where it should stop. So I'm going to lay this down. So now what I'm going to do is take some stomach content out to see if we are in the right spot. So what we want to do is get our syringe, clamp the tube here. We want to go ahead and pull out a little bit of stomach content or bile. It should be green. So we pull a little bit and it looks green so far. So we'll go ahead and clamp this off. And we're going to test our pH in the bile. So we'll put down a pH strip. And the pH balance is good. It is at 4, so we know it's good. So I'm going to dispose of this and get a new syringe. So now what I'm going to continue to do is, but before this, you want to make sure that you have proper placement of the tube. So what you want to do is listen. And this also starts the irrigation skill. So you pull on the air, you pull 30 cc's of air. And you make sure that you insert the tube into the blue tube. So what we want to hear is a swooshing sound. And that's when you know you have proper placement also besides the bile coming out of that tube. So you want to make sure that you do it slowly because some patients do experience nausea. And I do hear the swooshing sound. So that's good. We know we are in the correct spot. So I will clamp this. Okay. So now I will continue. Since we do know that it is in the correct spot, I already irrigated with there, so now I will get 30 cc's of saline solution. Okay. So we clamp. Go ahead and start inserting the solution into the tube here. Remember to keep doing it slowly. Okay. So now we want another 30 cc's of air to clear the line. And once again, the air goes into the blue tube, not the clear tube. But let go of the tube to make sure that air goes in. Okay, so we clamp. Okay, so now we will place the tube onto the suctioning machine. So we place it on our machine, we turn it on, we leave it running intermittently or continuous from 80 to 100 millimeters of mercury. So once that's done, we go ahead and we're ready for a tube removal. So what you want to do is go ahead and turn off the machine, grab some tissues, and instruct the patient to relax and take a deep breath in. So now, in this process, as he's taking a deep breath in, I will remove the tube, provide tissue, clean up, dispose of my material. I will document my findings, report any abnormalities, okay? And if any abnormalities do occur, we go ahead and report it to the physician and perform hand hygiene once we're done, dispose of everything, and those are the 4 steps. Thank you.